At the entrance, every second matters.
Let's move! Trauma Bay 1, now!
The medical team quickly determines whether the patient needs immediate emergency care.
Patient registration creates the identity of the medical journey, recording essential information so the right care can begin. Before treatment begins, healthcare professionals assess the patient's condition. This includes symptoms, vital signs, and immediate needs.
Not every patient has the same urgency. Triage helps the team identify who needs immediate attention and who can safely wait.
Inside the emergency department, the team works together,
Let's get him on the monitor.
assessing the patient
Starting oxygen at 15 liters.
Stabilizing immediate
Heart
problem.
rate is up to 112.
and searching for the cause.
Blood tests, imaging, and other investigations may be ordered to understand what is happening inside the patient's body. Outside the treatment area, the family waits. Sometimes the hardest part of a hospital journey is simply not knowing.
When the results become available, the doctor explains the findings, possible treatment options, risks, and what may happen next.
If continued medical care is necessary, the patient may be admitted for observation, treatment, surgery, or specialized care.
Admission begins a new stage. Administrative details, identification, room allocation, and medical documentation are completed. The patient leaves the emergency area and enters the ward. Another unfamiliar environment, filled with new faces, sounds, and routines. The nurse introduces the patient and family to the ward, explains basic routines, and ensures that essential needs are understood. The bathroom is right over there, and our visiting rules are posted here. The healthcare team reviews previous medicines, allergies, medical history, and current prescriptions to reduce medication-related errors. The patient's condition is documented carefully, creating a baseline against which recovery can be measured. Behind every patient stands a team: doctors, nurses, technicians, pharmacists, therapists, and many others working toward one goal. During rounds, the medical team reviews the patient's progress, test results, symptoms, and response to treatment. Sometimes more information is needed. Additional tests help the team confirm the diagnosis and choose the safest treatment. Behind every laboratory report is a chain of careful work, from collecting the sample to analyzing it and reporting the result. Imaging allows clinicians to see what cannot be understood from symptoms alone, guiding diagnosis and treatment. Once the diagnosis becomes clearer, the team develops a treatment plan based on the patient's condition, risks, and individual needs. Medicines are prescribed carefully, with attention to the correct patient, medicine, dose, route, and timing. Nursing care continues around the clock, monitoring vital signs, administering treatment, assisting with daily needs, and watching for changes. For the patient, recovery is not always comfortable. Pain and weakness can make every hour feel longer than the last. If a procedure or surgery is required, the team explains the reason, expected benefits, possible risks, and preparation involved. Before surgery, identity, consent, medical history, allergies, investigations, and safety checks are carefully confirmed.
Behind the operating theater doors, a highly coordinated team works with precision, concentration, and respect for every second. Outside, the family waits for news. Minutes become long, and every opening door brings a moment of hope. When the procedure is completed, the team continues monitoring closely as the patient begins the next stage of recovery.